Hello, this is Spanish Med with another YouTube video. Today we're going to see and explore how fast you should ask a question when making an assessment on your patient. And how you can see that constant process will actually result in a faster assessment. I see many times providers and nurses, whether it's NPs, PAs, physicians, nurses, go through it really quick when it comes to asking the symptomatology of their patients. So these are some of the symptoms that come to mind, after many years of working as an interpreter. So we have nausea, vomiting, fever, chills, headaches, dizzy, lightheadedness, and urinary symptoms. Of course, in Spanish, we have them as nausea, vómito, fiebre, escalofríos, dolor de cabeza, mareos, atareamientos, y síntomas urinarios. Now, oftentimes I see it, especially in the emergency room, where it's all very fast paced and you want to get through it really quick and you want to just see the next patient. You hear questions like this all the time. They ask the patient, have you had any chest pain, shortness of breath, nausea, or vomiting? And as we all know, the recency effect, information that comes last is remembered more clearly than that information that came first. So when you ask a question this fast, have you had any chest pain, shortness of breath, nausea, vomiting? You may ask this question every day, all day, and if you're working with an experienced interpreter, he may hit it on the spot as well and ask it really fast. Ha tenido dolor de pecho, falta de aliento, náusea, vómito. But the problem with this is that your patient, whether it's English speaking or Spanish speaking, he's only going to probably remember the nausea and vomiting, or just maybe the vomiting. Now, a better question to ask, so that you don't end up going back and repeating the question 2 or 3 times, is making a small pause after maybe 1 or 2 symptoms so that they remember all of it. So an example of asking the same question would be, have you had any chest pain, shortness of breath, nausea, and vomiting? That way you give them a chance for the brain to catch up and catch all the symptoms that you're asking. I find that to be quite helpful when it comes to interpreting for a provider, and we don't have to repeat the question most of the time because you've given them an extra second or two to catch up and actually analyze the question, rather than to just bombard them with one symptom after the other. Now, the same thing happens with the urinary symptoms. This is a very, very, very common question when dealing with urinary symptomatology. You will ask, any urinary frequency, urgency, blood in the urine, or burning with urination. They may just, again, it doesn't matter if it's English speaking or Spanish speaking, they may just answer the question to the last 2 symptoms or even just the last one. But if you ask it like this, any urinary frequency, urgency, have them answer that question and then move on to the next one. Blur in the urine, burning with urination, and then have them answer that second segment of the question. That way you don't have to keep going back and forth between all these 4 symptoms. Now in Spanish, you can ask it like this, tiene frecuencia urinaria, urgencia urinaria. Have them answer that question if they know what it means. And if they do answer it appropriately, then you can move on to the second segment of the question. Tiene sangre en la orina o ardor al orinar, blood in the urine or burning with urination. And the reason why, on part 1 of the question I say if they understand it, it's because, after working as an interpreter for quite some time, I find that when you say words like frequency and urgency, a huge segment of the population may not know what that means. So you kind of have to go deeper and explain it a little bit. I usually say, when I ask this question and I say it in Spanish and I'm referring to urinary frequency, I ask it like this: va mucho a orinar? So that means, do you pee a lot? Or I say, orina mucho, also meaning, do you pee a lot? Making reference to urinary frequency. And when I am asking about urinary urgency, I ask it like this, you know. And I've checked with providers too, and they're okay with me asking it this way. That way we get a more accurate answer, and we're not making mistakes or missing anything. When it comes to urinary urgency, we ask like, ¿le da muchas ganas de orinar que no se puede aguantar? And that means, do you have urges, a lot of urges of going to pee to the point that you can't hold it, to make reference to urinary urgency. And then after that, first segment broken into two is answered. Then I move on to the second one, in which I ask sangre en la orina, blood in the urine, ardor en al orinar, burning with urination, which is pretty standard, and they don't know what you're talking about. All right, well, thank you very much. You can follow me on Instagram where I post, word of the day, as well as my TikTok. Thank you very much.